looks like I already have your info. Right here, good. So let me just see. Okay, so we want to do a bit of a checkup on a few different things. So it looks like primarily we'll be looking at your ears and specifically a little more into your hearing, and also your sense of touch on your face. We want to take a listen to your heart and lungs and test your reflexes. Does that sound okay? Okay, give me just a moment. Excellent. So let me sanitize my hands real quick and we can begin. For this examination, I am going to need to be touching you. Is that okay with you? Do I have your permission to do that? Wonderful, thank you. So, what did you get into that we are primarily looking at your ears and your face, your heart and lungs, and your reflexes? I see. Bit of an enigma, aren't you? Now let me start, I think, with giving your ears a little once over. So I will be using my otoscope here. Pop a little speculum on the end. Just slides in like so. And we'll take a little peek. I'm going to look at the outsides of your ears firstly, and then we'll look at the insides, okay? Very good. So I'm going to get in rather close. Now for this examination, if you don't want to, you don't have to have your eyes open. You can keep your eyes closed for this. I'm not going to need you to do anything that involves your eyes. However, if you do wish to keep them open, you're more than welcome to. But I will tell you what I'm doing the whole time, so that if you do close your eyes, you're not lost and you don't get surprised by anything. Okay? Good. So let me take a look at your ear here. And let's see. I'm just going to get in a little closer here. So upon initial inspection, it looks like the ear is in pretty good shape. Not seeing anything out of the ordinary. I wonder. Just going to palpate this a little bit. You'll feel my fingers almost pinching and rolling the flesh a little bit. Feel for any inconsistencies in the texture. Okay. Right, and then I'm just going to pull your ear back here. Pull up and back. And then we can take a little look behind the ear. Okay, looks good back here. Let me go ahead and just put that back. Good. And now the other side. Let's take a little peek here. Good. So skin looks to be good color, and I'm not seeing any redness. Doesn't seem to be any signs of swelling, but I'm going to feel around a little bit here. You'll feel my fingers. I start right at the helix, at the innermost part of the helix, closest to your face, and then work around to the top of the helix, down to the middle of the ear, and around the lobe. bottom. And then we can feel around in the little inner structures, primarily the cartilage, right? Good. And any pain or tenderness? Good. Now let me go ahead and pull the ear back a bit. Back. And I can take a look behind here. Okay, there doesn't seem to be any anomalies in the skin here. I'll put this back. Put the ear back. Good, and I'm going to do a little bit of bilateral palpation. So like I had done before, although this time I'm going to go from the lobe and pinch and roll the skin all the way up and feel the structures along the inner part of the outer ear. So let me just start here at the bottom of the lobe, and we will work up. Good. All the way to the top, and curve back in. Good. Let me just touch at the tragus, press in a bit. Okay, and then around the inner bits here. Any pain or tenderness? No. Okay. All right, I think that will do. Give me just a moment. Now we can look with the otoscope. So I'll just ask that you remain still for me, and I'm going to flip on this light here, and we're going to take a look inside your ears, okay? So I'm just going to be very gently inserting the otoscope into the ear canal and taking a little peek around inside, looking at the ear canal, the tympanic membrane, the little hairs in the ear canal, any ceramin blockage or problems with the ceramin, that sort of thing. So I'm going to start over here, and I am just going to pull your ear up and back, and very, very gently insert the otoscope into the ear canal. And we're taking a little look. Good, okay. Taking a little look here. I see. So, looks like these structures of the ear are intact from what I can see. The tympanic membrane doesn't have any discoloration. There's no perforation. There's no swelling or bulging. The ceramin looks good. Normal color, normal consistency. And little hairs look good. The skin itself looks good. So I think overall you have some pretty healthy ears. So let me just pull your back again so I can just pull out the otoscope, and then we can real quick just switch to the other side. So I'm just going to pull up and back to straighten out the external auditory meatus, and we can insert the otoscope into the ear canal. Let me just drop my elbow a bit. There we go. Good. So, tympanic membrane is a pearly gray color. It has a bit of translucency to it, so we can see the cone of light bounce off of it, but more importantly, we can see the tip of the malleus, this part discharge, things of that nature. But that's all looking good on this side as well. So I'm going to pull the otoscope out. Let's straighten out the ear canal. Pull that out. Put it back. Good. Now, while I was doing that, did you experience any pain, discomfort? Maybe just a little bit of an itchy feeling. Yeah, yes, that can happen. That is normal. So give me just a moment and I'll record my findings here. Good. Let's do some of those little hearing tests. So I have 3 different kinds that we're going to be doing today. And then I have a couple of specialized tests. So we will start with doing a soft spoken hearing test. So I will be going on one ear or the other, and you let me know what you hear, okay? All right. Taper. Good, okay. Disc, yarn, bag, wood, blue. Okay, and did that sound overly soft to you? A little bit in the beginning, yeah. And did you have much difficulty with that? Not too much? Okay. And we'll go ahead and try with the whisper now. Walk. Ribbon. Brass. Rose. Book. Okay, that was that. Good. Flask. Handle. Red. Carpet. Orchid. And how was that? Okay. Was any of that overly difficult for you to understand? Okay. Now I'm going to test your left versus right differentiation, and I am going to be just rubbing my fingers together, rustling my fingers, maybe doing a little something like this on one side or the other, and I just want you to let me know whether you hear it on the left side or the right side. Okay? Very good. So, let me know if you hear it on the left or the right side. Good? Mm-hmm. Good. Good. Excellent. Mm-hmm. Good. 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 Yes. Wonderful. Good. Perfect. Excellent. Thank you. So now we are going to do a tuning fork test. I have 3 different tuning forks with me today. The first one is a 128 hertz tuning fork. This is quite a low tone, and it may be quite difficult to hear. Just keep that in mind. I also have a 256 hertz tuning fork right here, as well as a 512 hertz tuning fork right here. Okay. Excellent. So we're going to start with the lowest tone, and do remember, it may be a little hard to hear. Did you hear that? Okay. What about that? And that? How about that? We'll try a couple more times. Okay, and let's move on to the 256 hertz. Okay, did you hear that? What about that? Mm-hmm. Yes, it's quite a buzzy one, isn't it? Mm-hmm. Okay. And let's finish off that one with the 512 hertz tuning fork. Do you hear that? That? What about that? That? Good. Okay, so I'm going to be using our middle frequency here, 256 hertz tuning fork, and I will be asking you to differentiate between left and right. Okay? Tell me whether you hear it on the left side or the right side. Good. 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 Mm-hmm. Good. Good. Perfect. Now we are going to be doing our couple of special tests known as the Weber and Rinne tests. So what I will be doing, I will be taking one of the tuning forks, and I think I'm going to be doing the 512 hertz. That one is the easiest to hear. I'll be striking the tuning fork and I'm going to be placing it right in the middle of your forehead, a little bit towards the hairline. So almost where your hairline meets your forehead, right about here. I'm going to be placing the tuning fork right there, and I will ask you whether you hear it more on the left side, the right side, or right in the middle. And then I'm going to be striking the tuning fork, and I'm going to be putting it right behind your ear, on the bone behind your ear known as the mastoid process. On you, that's going to be right here, and it's going to be right here. Okay? I will ask you when you stop hearing the sound, and then I will be bringing it forward, and I'll ask you when you stop hearing the sound. Okay? All right, let's start with putting it right at your forehead right here. Hear it more on one side, the other in the middle. Now we'll do right behind the ear. So I'm gonna do this ear first. Tell me when you stop hearing it. Good. Tell me when you stop hearing it. And now on the other side, right on this side. Tell me when you stop hearing it. That was quick. Tell me when you stop hearing it. Very good. Let me just record my findings. Now we're going to be testing your sensation on your face. So our sensation is governed by a cranial nerve known as the trigeminal nerve. This is cranial nerve number 5, and the reason it's called the trigeminal nerve is because it has 3 branches on the face. We have the ophthalmic branch right here. We have the maxillary branch right across here, and we have the mandibular branch along the bottom jaw right here. And I am going to be touching each of these areas, and I just want you to let me know if you feel a touch. You can just say yes. Okay? Right, so yes, touch, yes, touch, touch, yes, touch, yes. And did those feel the same on both sides? Good. Let's do that again. Touch. 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 And did you feel those all the same? Very good. Now I'm going to ask you to differentiate between left and right. So just let me know if you feel a touch on the left or the right side. Touch. 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 Good. Touch. 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 Good. And did all of those touch sensations feel the same? Both sides of the face, each part of the face? Good. Now we are going to be using this little handy tool that's kept in my Trömner hammer here. I'm just going to twist it out of the hammer. So we are going to be doing the soft, sharp sensation test. Let me just press the tip of the sharp end just at your jaw so you know what that feels like. What it is a cold little metal tip. It's like a little cone. So it's not actually sharp, but it is a pointed contact. Let me just show you. This is sharp, sharp, sharp. Okay? And on the other side, we have a brush. And I can either make the brush long, looser bristles, or I can put on their little guard and make them have these firm bristles. I'm going to have them loose for this part of the test, and I'm going to test on your jaw the sensation of soft. Let me just show you what soft feels like for the purposes of this test. Soft, soft, soft. Just like that, okay? You just let me know whether you feel soft or sharp, okay? Do you feel soft or sharp? Soft or sharp? Okay. And do you feel soft or sharp? Soft or sharp? Okay. Soft or sharp? Soft or sharp? Soft or sharp? Soft or sharp? Okay. Soft or sharp? Soft or sharp? sharp? Soft or 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 sharp? Okay. Soft or sharp? Soft or sharp? Good. Soft or sharp? Soft or sharp? Soft or sharp? Soft or sharp? Good. And now we're going to test your vibration sense. So I'm going to bring out our 256 hertz tuning fork again. And this time I'm going to ask you if you feel the vibrations when I put it on your face, okay? So just let me know when you feel the vibration. Do you feel that? 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 Good, good. So vibration sense is intact and sensation seems to be quite intact. Give me just a moment while I record this. Excellent. Now let's take a listen to your heart and lungs. And then the last thing on the agenda will be us testing your reflexes. So I'm going to pop in my stethoscope. We're going to take a listen to your heart and lungs. Good. Now I am going to be placing the stethoscope on your chest on your left side. I'm going to be placing it in several areas along the chest up to the side of the chest as well. All going to be on the left side primarily. So I want you to just breathe normally for me. And give me just a moment. Warm that up a little bit. Good. Now just breathe normally. And I'm going to take a little listen to your heart with the stethoscope. Good. Mm-hmm. Good. Mm-hmm. Okay. Good. Now I'm going to take a listen to your lungs. So you will feel me placing the stethoscope on each side of your lungs, each side of your chest rather, to listen to your lungs. And I'll be going in almost a ladder-like pattern. So let's say I'm on the right side. Go left, left, right, right, left, left, right. Okay? So I'm always comparing each lung to the other, how they're sounding. So I'm going to place the stethoscope on your chest, and when prompted, I want you to take a deep breath in and out, okay? Take a deep breath in and out. To the left side, deep breath in and out. Down the left, deep breath in and out. To the right side, deep breath in and out. Down on the right side, deep breath in and out. Back to the left, deep breath in and out. Down on the left side, deep breath in and out. And on the right side, deep breath in and out. Good. Now I am going to go behind you and I'm going to take a little listen to your lungs. Give me just a moment. I'm going to place the stethoscope on your back, and I'm going to have you take a deep breath in, placing it on the right side of your back. Deep breath in and out. Good. And switching to the left side. Deep breath in and out. Let's go down a little bit on the right side. Deep breath in and out. And on the right side, deep breath in and out. Good. Down on the right side, deep breath in and out. Switch to the left, deep breath in and out. Good. And down a little bit on the left side, deep breath in and out. And switching to the right, deep breath in and out. Okay. You can go back to breathing normally. And let me squeeze right in here. There we go. There we go. And let me record my findings about your heart and your lungs. lastly, we are going to test some of your reflexes. Now, I mentioned before that I have a reflex hammer known as a Trömner hammer, and I can do most of your reflexes with the Trömner hammer. What I cannot do is the Babinski's reflex on the sole of your foot. I don't have that nice thin blade like my Taylor hammer would have. So we are going to stick with some of the basics. First, I'm going to start with your Achilles tendon, okay? So I'm going to come just by your feet here and we'll work our way up. So I'm just going to give it a good tap, tap, tap. Good. Let your feet relax. There you go. Tap, tap, tap. Good. We'll do the knee jerk. Just let your legs go floppy. Okay? Tap, tap, tap. Good. Good. And now let me see to do the biceps reflex. So I am going to hold on to your elbow here. I'm going to put my thumb in the crook of your elbow. I'm going to wrap the rest of my fingers around the back of your elbow. I'm going to be tapping on my thumb that's on the crook of your elbow. Okay, so we're just going to do a little tap, tap, tap. Good. And the other side. I'm going to wrap my fingers around your elbow and put my thumb in the crook of your elbow and tap on my thumb. Good. Now we'll do the triceps reflex. I'm going to be picking your arm up and it'll be parallel to the ground while your arm goes perpendicular to the ground. And I'm going to be tapping at the back of your elbow. I will support your arm. I just want you to relax your arm. So I'm going to pick up this arm right here. Okay? And holding it in my hand, and I want you to just let your arm go floppy. Okay? We will tap, tap, tap. Good. And we can put your arm down, and then we're going to lift up this arm. So, I'm going to lift that up, let your arm go floppy, and we will just tap, tap, tap on the back of your elbow and let your arm go down again. Okay? So let me just put back my little sensation testing tools, as we will not be needing our reflex hammer anymore. Okay, I'll go back together. Makes a spot of noise when they're all together. I like to take them apart. Let me just record my findings with your reflexes. And that will conclude our examination. And I wanted to ask if you had any questions before I submit my report. No? Okay, very good. So I found nothing out of the ordinary with your hearing, your sensation, or with your heart and lungs and reflexes. So I am going to finish this up. We'll get that sent off. will end our time here today. I really hope that you enjoyed this examination, and I hope it was nice to keep your eyes closed for a while I conducted my exam. You were an excellent patient, even though you didn't have your eyes open, so I really appreciate that. I hope you have a whale of a day and a good rest of your night. Thank you. Goodbye now. Thank you so much for watching this video. I really appreciate it. I create primarily medical, alternative medicine / pseudoscience and personal attention ASMR roleplays. If you want to check out a specific category of my videos, my channel playlists have everything from sci-fi to historical to even fantasy videos. If you want to support my work, consider checking out my Patreon profile in the description box, where I offer early access